Hello guys, welcome back to Medicodays. So in this video, we'll be doing the last 50 question recall of Neetpg 2025. By completing this video, we will be completing all the 200 questions which had come in Neetpg 2025. Guys, if you have any queries or if there is any question which has repeated or if there is any wrong in the answers, please do mention the question numbers along with the query in the comment section. Or you can text me personally in Telegram or you can put in my Telegram group as well, so that it will help me make the final video of all the 200 questions tomorrow, which is after proofreading and which is completely correct. So I need your help for that, guys. Now quickly moving on to the first question of this video. Drug of choice for prophylaxis of PSVT, answer oral verapamil. Next, a woman with migraine was started on sumatriptan. She has family history of coronary artery disease. Appropriate drug for migraine prophylaxis is propranolol. Next, component C5 to C9 is related to Neisseria. Next, a patient with spontaneous bleeding precedent to AED. Histopathology revealed presence of blast cells, more than 25% of the cells. Most likely translocation is T1517. Next, a patient says that when he sits down, he hears flapping sounds of birds' wings. He believes it is a sign of God to him to move in a specific direction. Which psychopathology does it present? Delusional perception. Next, the 35-year-old is found wandering in another city by a social worker. He is confused about his identity. He cannot recall how he reached there. There are no signs of intoxication or head injury, and medical evaluation is normal. He is unable to provide personal information, and he seems to have sudden unexpected travel away from home. Diagnosis is dissociative fugue. Next, Mr. K is rigid, overly focused on rules and order, and perfectionist. He often submits his work late as he focuses on perfection. Personality disorder is OCD. Next question, during surgery, a muscle relaxant administered to a patient led to facial flushing and hypotension. It is because of, answer, atracurium. Next, MCO is used for, it's an image-based question, answer is VUD. Next question, following a building collapse, a patient with airway obstruction undergoes a procedure and an image is given. True about it is, it will be followed by tracheostomy. Next, identify the type of suture material in the image. So PDS was given in the image, answer is monofilament. Next question, true about varicose vein, answer is it can progress to eczema and ulceration. Next question, it is a question with normal thyroid uptake, answer is iron deficiency. Next question, blood sugar levels was raised 2 to 3 times and then stayed elevated for a constant period of time. Correct about it is, first it rises and then sustained increased level. Next, based on VVM, which vials can be used, answer 1 and 2. Next, a 30-year-old man with bronchial asthma is currently using salbutamol and ipratropium metered dose inhalers as needed. She reports frequent nocturnal symptoms including wheezing and breathlessness that woke her up several times a week. Most appropriate next step in management, add LABA and inhale corticosteroids. Next, a patient with diabetic ketoacidosis not a part of initial management is IV 3% NaCl. Next, best PCR method to diagnose organism causing meningitis, answer multiplex PCR. Next, a 46-year-old woman with 16 mm endometrial thickening on transvaginal sonography. Next step is endometrial biopsy. Next, a 65-year-old postmenopausal woman presented with blood-stained vaginal discharge, BP is 170/100. Next step, pelvic examination with pap smear and TVS. Next, a pregnant lady in first trimester with history of toxoplasmosis 5 years back. IgG is positive. What advice is given? It is safe to continue the pregnancy. That's the answer. Next, prolactin will cause amenorrhea because of, answer, decreased GnRH. Next, a 23-year-old woman comes to OPD. She does not remember her LMP. Best method to calculate her period of gestation, answer is crown rump length. Next, an NST is being done for a patient who presented with decreased fetal movements. NST showed 1 acceleration in 2 minutes. Next best step is continue NST till 40 minutes. Next question, a 15-year-old child with type 1 diabetes mellitus presents with vomiting, diarrhea and fatigue. Blood glucose is 700, sodium 125, potassium 4.2. Which of the following is not appropriate in initial management? So guys, this is a repeat question, but instead of that you can get another question, which is a patient with marked elevated plasma phenylalanine levels and low thyrosin level, and phenylalanine hydroxylase enzyme assay is also normal. Which of the following cofactor deficiency is most likely responsible for this presentation? So answer here will become biopterin. And also guys, there's one more question which is quite doubtful whether it was not there or not, and that question is, a frameshift mutation occurs because of insertion of a new nucleotide at the 4th position of an mRNA sequence with 900 nucleotides. What is the most likely outcome of this mutation? So answer in that case is complete change in protein production. So guys, if at all this question was there, please do let me know so that I'll add it up. Next question, a 36-year-old woman with symmetrical small joint arthritis is positive for anti-CCP antibodies. Which histopathological finding is most characteristic? Answer, Panis formation. Next, a patient presents with sudden onset weakness and aphasia for 2 hours. Pulse is irregular. CT head is normal. Immediate next step is start TPA. Next question, a 45-year-old female with 6-month history of PND, palpitations and breathlessness, irregular pulse, hepatomegaly, heaving apex, mid-diastolic murmur at apex. Patient also has history of acute rheumatic fever in the past. What is false? Pre-systolic accentuation of MDM is a hallmark feature. Next question, a 60-year-old patient with AF and aphasia and weakness. Next step is TEE, that is transesophageal echocardiography. Next, calculate the anion gap, sodium 130, chloride 84, bicarb 16, answer is 30. Next, a 60-year-old man with long-standing COPD presents with dyspnea, pH 7.32, PaCO2 is 60, bicarb is 30, primary acid-base disorder is chronic respiratory acidosis. Next, a 48-year-old man with ARDS due to COVID-19 is on mechanical ventilation. Which ventilator strategy is most appropriate? Answer, high PEEP and low tidal volume. Next, a 34-year-old female presents with right upper limb weakness over 3 months. There is marked atrophy of right deltoid and biceps, fasciculations and hypertonia. Deep tendon reflexes are absent in right upper limb with intact sensation. Site of lesion is anterior horn cells in the cervical spinal cord. Next, a 55-year-old man on long-term hydrochlorothiazide for hypertension presents with progressive symmetrical distal paresthesia, weakness and signs of heart failure. Examination reveals decreased vibrations and position sense in the feet. Nutrient deficiency is of vitamin B1. Next question, hospitalized patient was administered IVF, after which he developed hyperchloremic metabolic acidosis. Which fluid is responsible for this? Answer is normal saline. So guys, I'm doubted whether this was a repeat question again, and if at all it is a repeat question, a differently framed question, which is again which is repeated, then instead of that you can use the previous question which I had already mentioned, where the answer would be complete change in the protein production when the MRI sequence is changed. So that can be used up here. Please do mention about it in the comment box if you have an idea about it. Next, a 38-year-old man presents with salt craving, generalized hyperpigmentation, hyperkalemia and metabolic acidosis. Diagnosis is Addison's disease. Next is a chest x-ray, and here again it's a confusing question. So the answer could be lung collapse, lung consolidation or lung abscess. All the three were there in the options. Depending on the x-ray it would be. And next, a question on prolyl hydroxylase was there. Next, in a submandibular gland resection, which structure can be affected? Answer is facial artery. Next, which nerve doesn't pass through the marked foramen? Answer is hypoglossal. Next one, a 60-year patient presents with epistaxis, non-hypertensive, and packing was unsuccessful. Which artery is ligated for relief? Answer is phenopalatine artery. Next, a patient presents with displaced nasal bone fracture after an RTA. Which instrument is used for nasal bone reduction? Answer, Walsham forceps. Next, a 25-year-old presents with ear discharge episodes and decreased hearing. Best treatment option is myringoplasty. Next is an image-based question. Identify the PTA type. Answer, left conductive hearing loss. Next question about total laryngectomy was there. And next, there was a leak of toxic fumes from a factory. Next step by civilian who have been informed about the leak is close all windows and cracks in home. Next, clinical scenario of xeroderma pigmentosa is explained. And which DNA repair pathway is affected? Answer, nucleotide excision repair. Next, a 16-year-old girl gave consent for sexual intercourse. Answer, girl's consent is not valid as she is less than 18 years old. Next, a man assaulted his colleague. Upon being caught, claimed that he heard his boss telling him that his colleague is going to kill him, and so he attacked in self-defense. Next step is refer him to a psychiatrist for comprehensive evaluation of the mental state. Next, a man survived without food for 5 days. Primary energy source for brain during starvation. Answer is ketosis. So that's it guys. We have compiled all the 200 questions. If there is any question which you are doubtful or any query is there, please don't hesitate to put it up in the comment box or to text me, or you can put in the Telegram group, because it will help me in making up the final complete proofread 200 questions video tomorrow. So I really need your help, and till I come back with my new video, stay tuned. Till then, bye.